Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Almost everyone has heard of ADHD, Attention Deficit Hyperactivity Disorder. It makes people think of kids who have trouble paying attention or who are hyperactive or impulsive. I think I was like that as a kid.
Maybe.
But it's not just a problem for kids. About 4 to 5% of the U.S. adults have it, and that's about 8 million people.
I identify very strongly with this topic. Let's just say, here's the problem. Not many adults, less than 20%, get diagnosed or treated for it. And that's unfortunate because in addition to causing trouble in your daily life, your work, and your relationships, ADHD can cut an estimated 8 years or more off of your life expectancy.
Surprising.
Really shocking. To learn more about adult ADHD is family medicine physician and ADHD expert, Dr. Bob Wilfahrt. Welcome to the program, Dr. Wilfahrt. It's nice to meet you.
It's nice to be here. Thank you for having me.
You know, Dr. Wilfahrt, I would say that most people, including myself, are sort of surprised to know that 1 out of 20 adults in this country has ADHD.
It's not the kind of thing that you talk about when you're meeting your friends for lunch, though, is it? And you, Dr. Shives, are a successful man. I'm suspicious that perhaps ADHD doesn't show itself very commonly in the circles in which you run. And so unless it's something that we look for and seek out, it's pretty easy to miss.
No kidding. Well, does everybody who is diagnosed with ADHD as an adult did they have it as a kid?
By definition, so ADHD is a neurodevelopmental disorder. A person who suffers from that distractibility, that impulsivity, was born that way. It's not a behavioral choice. It's not a result of their parenting. It's not a result of any habits that they might have grown up with. So they came out of the womb with ADHD, and it's been with them 24/7 since. There are some adults who from time to time feel distractible. And of course, there's so many things that go on in our lives or other medical problems that sometimes we forget the name to somebody that we meet in the hallway or miss an appointment or fail to complete an obligation on time. It's not always ADHD because of the way our lives are chaotic.
But there's a certain number of kids who actually outgrow ADHD, right? And do not have it as an adult, or no?
Not nearly as many as was once thought.
Really?
It had been told to parents for a long time that, Johnny's having trouble in 4th grade, but he'll be a great adult. And he probably was, but he's probably a great adult with ADHD. Yeah. So what happens is the hyperactivity that those kindergarten teachers are dealing with tends to fade away with time. It takes a lot of energy to be hyperactive. And as a guy in his 40s, I can't maintain that, right? But the impulsivity and the ups and downs of emotional dysregulation persist. So I might not fidget as an adult, but I might not finish the bathroom remodeling project that I started 6 months ago either.
You just learn how to kind of work around the ADHD that you have and grow up learning tricks and tips on how to get around them. Or you don't, and your bathroom goes unfinished.
So it's estimated that 1 out of 7 or 1 out of 8 children truly outgrow the condition. They're able to learn sufficient coping mechanisms that as an adult, no symptom would be discoverable. But that means 6 or 7 out of those 7 or 8 continue to have symptoms that are discoverable in adulthood. And for many of them, they find ways to cope. They're good at using Post-it notes and trapper keepers, or they marry someone who's a little OCD, and that kind of helps them out a little bit.
Counterbalances it.
But for many, they don't find that way. And so it won't be hard if you think of that mental Rolodex you have to think of acquaintances or family members who bounce from job to job after 6 months at a new place, just as most of us would be kind of getting into a rhythm of the workplace. They're bouncing out. It just didn't work out for them.
When we used to think that it was 50 or 60% of kids who outgrew ADHD, you're saying that's not true at all.
It's not true at all.
So are the symptoms the same, and why is it important for these people to get help?
Yeah. The symptoms do change. The hyperactivity fades with time. impulsivity, emotional dysregulation persists. When adults with ADHD are asked what bothers them about their pattern of thought, what they say is emotional dysregulation, a tendency to feel very sensitive to any possible slight from another person, is enough to make what had been a great hour feel crushing for 15 minutes. And then they're better again. And so sometimes a person might come into the office and say, oh, my girlfriend thinks I'm bipolar. And it's not that. It's that their emotions bounce. So emotional dysregulation is a prominent symptom in adults. The other symptom we hear quite a lot is trouble sleeping. Because if you have ADHD, you have it 24/7, even when you're asleep. And so a person who feels physically tired, but their thoughts are bouncing from thing to thing at night, not racing, it's not fast, but they're thoughts that seem disjointed, might have ADHD at bedtime. So they're awake at 2 a.m. wishing they could be asleep. Finally, they're so exhausted they sleep the sleep of the dead at 4 and 5. But then the alarm clock goes off and they're wrecked, and they can't get their shoes on and get out to meet the bus in the morning.
So is it, I had never heard that ADHD can cut life expectancy.
It's striking, isn't it? So that data is relatively new. Just last fall, some researchers based in Milwaukee came out with data that used life insurance claims to find that out. These are researchers who had identified children with ADHD back in the 1970s and followed them till the current date. And a child who, quote unquote, outgrew it or thought they had, received treatment as a child but not into an adulthood, would lose perhaps 7 years of life. Wow. Because that stunting of development, that loss of tips and tricks persisted throughout adulthood. A person who never got treatment, whether an adult or a kid, might have lost 13 years of life. It is a huge impact. And if you think about it, part of that's because they're stressed from being unsuccessful. Right. They seek coping in alcohol or smoking or other bad choices. Or maybe they have diabetes later in life, and you both know diabetes is picky. It's a burden. You have to test yourself and change doses and 4 times a day, this and that. And if you have ADHD, you're not good at that kind of complexity. And so caring for yourself later in life is difficult.
Is adult ADHD a relatively easy diagnosis for you to make in the office, or does it require psychological testing?
It would be lovely if there were enough psychological testers in the world to allow everybody to have that kind of diagnostic evaluation. Unfortunately, there isn't. And so what most of us do is, over a series of office visits, ask about a person's current function, their other diseases. So perhaps maybe they're not paying attention because their asthma is so bad they're working to breathe. We ask about their other mental health conditions. ADHD is a snowball. If you've been ineffective your whole life, you tend to feel bad about it, and so it sort of collects anxiety and depressive symptoms as well. But then we also ask you to remember back in childhood. Remember, it's a neurodevelopmental problem you had since infancy, and so some symptoms should have been present in early childhood. If there really wasn't, then it's not ADHD. The trouble arises is that many people in the 1940s and 50s and 60s didn't know about the condition. And they assumed, oh, Johnny's just a boy, or Mary, sit still, look pretty. And their inattention, their hyperactivity wasn't named back then.
So it's important to find out because it can have such a major effect on your life. But tell us about treatment. We don't have a lot of time to go into the specifics, but how successful is it?
Surprisingly successful. It's probably the easiest neuropsychiatric condition to successfully treat.
With medication?
So I believe because it's a neurodevelopmental disorder, we all need this vitamin-like substance called dopamine in a certain part of our brains, and there's some very inexpensive, easy-to-use medicines that put dopamine there. There are non-medication ways to address the symptoms too: counseling, those Post-it notes, exercise, good nutrition, the things that make all of us feel better, also helps a person with ADHD. but there are stimulant and non-stimulant, uncontrolled, inexpensive medicines that well address these symptoms.
Well, that's so good to hear. Well, it's a problem that affects some 8 million adults in the United States. ADHD, it's not just for kids. As we've just heard, there are a lot of good reasons to find out if you might be one of those who suffers with ADHD as an adult. We've been talking with an adult ADHD expert, Mayo Clinic family physician, Dr. Bob Wilfahrt. Thanks for being with us, Dr. Wilfahrt.
Thanks very much.